We are at SAfm Radio at Koketso Sachane, or use the hashtag SAfm Meeting Point on Twitter. A number of organizations have sworn to challenge the implementation of the National Health Insurance Bill. This was after the National Assembly passed the bill with 205 MPs voting for the bill itself. The NHI, which has been in discussion for a number of years, is set to provide for one pool of healthcare funding for private and public healthcare providers. While some have welcomed the passing of the bill, there is opposition in some quarters. So what does it actually mean? What is the NHI? Dr. Ntuthuko Bhengu is founder of Alchemy Health Technologies and a National Planning Commissioner, joining us now on the line. Dr. Bhengu, thank you very much for making time. Good evening.
Good evening, Koketso. Good evening to your listeners as well.
NHI, and even as a SAfm person who has spoken to the issue for a number of years, I can say that I can't quickly summarize exactly what it is. So I'm going to be learning as well in this here conversation. What is the NHI?
Yes, Koketso, the NHI, obviously National Health Insurance, is what I would call the local version of what is supposed to be universal health coverage. Universal health coverage, though, is far more comprehensive because it's not dealing with the narrow definition of insurance, because insurance refers to, obviously, the payment mechanism. On the other hand, if you're talking universal health coverage, the payment mechanism is just one aspect of what is intended to benefit the population of any country. But the core principles of universal health coverage in this regard, one has to look at, I like to first look at what the ultimate goals of universal health coverage are. And there are three main ones. One is that services are available on the basis of need, not on the basis of whether you can afford services or not. The second one is that there is some element of financial protection, a great deal of financial protection that must happen. And what this means really is that nobody should go bankrupt looking for healthcare services, because certainly to a great extent we cannot really control our health. A big part of it has to do with genetics, and obviously also as we grow older, some conditions are beyond our control. So no one really should go bankrupt looking for healthcare. It is surprising that in the United States, a wealthier country as it is, has got a very high and documented examples of people going bankrupt trying to find healthcare. So that's the main thing in terms of protection against financial hardships. And then the third one, in terms of goal, is that the services must be of sufficient quality to make a difference. It's one thing to say I have access to service that I don't pay at the point of service, but if the quality isn't at the right standards, it doesn't really help. So those are ultimately the three goals that universal health coverage system is trying to get to. Now, but then how the mechanics of how you get there, the big part of it is now what you're talking about, the NHI in terms of insurance. And the main principle here is that it's a principle of the healthy subsidizing the not so healthy, and those who are wealthy subsidizing the poor. Basically, the principles of solidarity, which I support completely. And a big part of this is that it shouldn't matter that you can't afford. If you need healthcare, you should have access to it. And I think that's just the basic of what any country that calls itself civilized should be able to offer. And the mechanics then is about collecting as much in terms of funds from those who can afford to pay as much as possible into one pool to be able to facilitate a sort of sufficient buying power that you can strategically deploy those funds to purchase services on behalf of the population. And the issue of pooling this, it's certainly an insurance. That's the insurance part, where you minimize risk by making sure that there's sufficient pools, because obviously in an insurance situation, someone will utilize services more than the other based on need. So that's where the insurance part comes. But a big part of that is that then there must be strategic purchasing, meaning that you are able to deploy those funds in the best possible manner to achieve the three goals that we spoke about at the beginning. So then, of course, the elements of service delivery and a very well-designed benefits, because if you do not cover the conditions that matter, it really won't be of much help to the population.
We are in conversation still with Dr. Ntuthuko Bhengu, making sense of what is the NHI. Again, Dr. Bhengu, thank you very much for making time. I really appreciate the picture that you painted. What I want to understand even more on a practical level, you spoke of how those who were able to draw resources, financial resources into this pool, and it is from that pool that we're able to draw from and hopefully be able to provide access to adequate healthcare. The pool itself operating within a system historically, still today actually, two parallel health systems. There's the private and there is the public. How then, or what does the NHI say in relation to how the pool is used, or the resources within the pool are used by those of us who are on either side of this two parallel health system?
Yeah, it basically says the mechanics, the cheapest way, the most efficient way of drawing the pool is through payroll taxes, because we all pay taxes to SARS, and that's the cheapest way if one looks at the logistics of it. But I think the main point of your question touches on the point that everybody who is part of the population should be able to benefit from services that the insurer, in this case of the government, purchases on behalf of citizens. Now, the history that we have in South Africa, of course, is that the wealthy will purchase their services will purchase insurance through medical schemes or health insurance products, and typically go to the private sector, the private GP, the private specialist, be seen at a private hospital. So that's the one arm when we talk about the issue of segregation of services. And then, but on the other hand, if you do not have private health insurance, of course, you're seen in the public hospitals by practitioners employed by public service. And your contribution is means tested, meaning if you don't have any income at all, you still will get seen. But if you do have income, there is a tiered rate that you pay for consultation, but it's certainly much less than what you pay in the private sector, for example. Now, the difference here is that we don't build enough hospitals in the public sector, and we don't produce enough practitioners in the public sector, which is why the purchasing will have to include buying from private sector professionals and private sector health establishments. So
and that raises a whole other issue of the whatever deals that need to be made and what the private healthcare practitioners or those practicing in the private healthcare agree to. But I don't want to take too much of your time, Dr. Bhengu, because we have a couple of calls and I've got many questions, but
sure.
I need to give others an opportunity to ask. Ntate Mtaung in Bethlehem, Ramokolo, thank you very much for making time. Good evening. Yes, sir.
And good evening to Dr. Bhengu and the listeners of SAfm.
Good evening, Mr.
Dr. Bhengu, I just want to give, just in short, what I understand about NHI, and then I would love you to make a comment whether I am correct. To me, NHI it's a system that is designed to help to eliminate inequality in our country.
Yes.
When one looks at the budget of the Department of Health, plus minus 8.5% of it is allocated to health nationwide.
Yes.
But of that 8.5%, about 87% of it is only benefiting about 13% of the population who can afford medical aid. And the 87% of mostly the poor are to share the 13%, which is actually meant for the poor and the have-nots. Now I see this thing in two lights. The reason why people who are having medical aids are afraid of the NHI introduction, it is because, number one, they fear to become part of the total people of South Africa. Why do I say that? Even if you have a medical aid, if you are in a private clinic, as soon as that medical aid is exhausted, you are wheeled on a wheelchair, you are pushed out, you are sent back to the public hospitals. Because even though people are saying they are going to lose benefits, most of the money which the medical aids are paying, they are benefiting only the medical aids owners, not so much even those professionals who are working in there. And the Department of Health now has got to deal with plus minus 20% of the remainder of that budget to address the issue of the poor. Now, in a democratic society that we're having, this is very abnormal. So NHI is trying now to bring this into one pool, like Dr. Bhengu has said, where this pool now will be managed to service the total population of our country. But the other challenge also in the public sector is, like Dr. Bhengu has mentioned, we don't have really well-equipped hospitals and clinics which are going to execute that. We do not have enough professional medics. So the problem will be, how are they going to upgrade the hospitals in the public sector so that when NHI is being introduced, it should bring about that desired intention. That is what I would like to say in short and comment from Dr. Bhengu.
Dr. Bhengu?
Yeah, Mr. Ntuthuko is raising very good points. What I painted earlier was really just a picture of how universal health coverage should work. But we also have to be mindful that South Africa has a history in the issue when he speaks of 8.5%, that is absolutely true of GDP. It's more than even what the World Health Organization recommends countries should spend on healthcare. But the big challenge is whether we can afford the risk of having both private and public sectors being controlled through one fund. The fear obviously comes from the point of incompetence, on the point of corruption, where the whole system is at risk at that level. Now, personally, my position in terms of looking on the one side, the principles of making sure that you eliminate the two-tier system where the one system serves the rich, the one serves the poor, my personal view is that we'd be better served by a situation where everybody contributes towards the NHI. So if you want to still subscribe to private insurance out of your disposable income, it must be after you've paid for the NHI. And remember that what is not in question here is whether private practitioners or private facilities will be available to the NHI. So we saw this during COVID. COVID was the perfect test in terms of what can be achieved through universal coverage. If you needed an ICU bed, it did not matter whether you've got medical aid or not. You got a bed in a private hospital that government ultimately has an arrangement with the hospital to pay for.
Dr. Bhengu, my apologies. we have another break, and I've got another call. Mike in Newlands, I see you. Will take Mike's call, and then we can release it. Dr. Bhengu, really appreciate you giving us time. We continue to make sense of NHI, taking your calls, your WhatsApp voice notes as well. We conclude our conversation with Dr. Ntuthuko Bhengu, making sense of the NHI. And Mike in Newlands, you've been very, very patient. We appreciate your time. What's your call, comment, or question for Dr. Bhengu? Good evening.
Sure. Hi, good evening, Koketso, and good evening to your guest. My comment is that I'm confused. We already have a health system within our government. Every province, every town has a government-run hospital. Yes, I know they're all collapsed, and we all agree they're corrupt. Nobody's going to argue with me when I say that, and they are mismanaged by cadres. So now, I want to know is I did not vote for this government. This government runs those hospitals, and the people now get the benefit of these corrupt, incompetent hospitals, which are in fact nothing more than death factories. So I decide, because we live in a democracy, I'll take my hard-earned money after tax, doctor, because the money, remember, I'm paying for these hospitals which I don't want to use. So I'm going to take my hard-earned money after tax, and I'm going to pay for a quite expensive medical health care, but that doesn't matter. I don't mind, because the people of South Africa voted in a government that has delivered a service which they don't like. Now, all of a sudden, doctor, I am being asked to now pay for another service on top of that service because I don't want to die in a government hospital. My point is this, doctor. What am I misunderstanding here? We have two hospital groups. The private health care is paid for by me and other people that want to pay for it. So it's not a burden on the government. I already pay tax. Out of my tax comes money for the police, for hospitals and other services. If I don't like the police, which by the way are equally useless, I have to now pay for ADT to walk up and down and guard my house. But that's my problem. The point is I want the right to pay for it. So I don't understand why I have to be sucked into this whole thing. I'm paying for private medical health care. It is up to the government to improve their health care, or it is up to the people of this country, doctor, who voted in the government that gives us this, honestly, the worst health care in the world, to actually do something about it. But it's not up to them to go to me or other people that pay for private health care who want to have nothing to do with the government health care, because why should I? I really pay for it and I don't use it.
Let's have Dr. Bhengu respond to that. Mike in Newlands, again, thanks for your patience. Dr. Bhengu?
Yes, I think the reality is that health is not a normal good. So and everyone, I mean, any country's development prospects are tied to health of the population. It's a productivity issue. We saw, again, when COVID struck, we couldn't work. And for example, some conditions like that, I mean, we can't be all healthy if some of us are unwell. So healthcare does have a very special consideration, and that's why the principle of solidarity and cross-subsidization is important, because ultimately there is benefit. But of course, in South Africa, there is a history we cannot forget regarding the income levels of our population. That matters too. But if we are going to move forward, this is what must happen. But Mike is right in sort of saying that there is a management problem, because we know that the money that is being spent as a percentage of GDP in the country is actually adequate for purposes of getting the country to run properly. The private sector is not perfect. The public sector, certainly, we all know the issues there. So it's an issue of basically making sure that the right regulations are in place in preparation for the implementation of the NHI ultimately. But what is critical, and I stress, and the point I spend time explaining the difference between NHI and universal coverage, is that there is a lot that can be done today, mainly on the infrastructure side, on the provision, on electronics and procurement systems, that can make a big difference. And I cite Ideal Clinics, where primary healthcare clinics, the program is ongoing, that make sure that there's such very good services that keep us well, so that we move from sickness care to preventative care. All of that can be implemented today properly, whether NHI, as we define it, comes in 5 years or 10 or 15, but those will make a difference today. So it's about, as I say, that the NHI or universal health coverage isn't actually a destination, it's a direction. Where you start in a certain way. All I'm just saying is that what we cannot afford is to risk and bet the whole 500 billion rand every year in terms of one system. And this is where I say the point is to make sure that, of course, having to pay twice is not ideal, but Mike gave you very good examples regarding security, regarding private schools. But the best situation for South African population is that we must get to a stage where the public sector is actually so good that people start saying, I'm actually wasting time by taking additional medical aid or health insurance cover.
Right. And that is a journey.
The best situation, yes.
Yeah, that is a journey. Dr. Bhengu, we really appreciate your time. You've given us more than we were hoping for. Thank you very much for allowing us into your space this evening and for all that you've shared.
Thank you so much. The pleasure is mine, Koketso. I appreciate you and your listeners. Thank you.
Thank you, Dr. Ntuthuko Bhengu, founder of Alchemy Health Technologies and a National Planning Commissioner, making sense of NHI. And this is a journey that will continue.